I think that the mood is difficult to judge, and some of the surveys I've seen suggest that actually a lot of people are pretty nervous about it. I think probably the informed position is that everybody is still hopeful that it's going to be okay, but there's a huge amount of uncertainty about that still.
How much concern is there that case numbers will just skyrocket and quickly surpass that peak seen even in December?
So, I mean, the case numbers are already incredibly high and they're going up. So there's no question that that's going to happen. The big question and the big uncertainty is what does that mean in terms of the harm caused by the virus? As we know, not everybody who gets infected is seriously ill. In fact, quite a lot of people have a very mild disease. What we're finding out now, though, this sort of real world, almost real world experiment is after the vaccination program, which has been so successful, how much has it pushed down the harm in terms of hospitalization, severe disease, and of course, eventually death? And of course, that lags a long time after the cases. So we're yet to see what this means in terms of the harm that's caused.
Well, the British Health Minister has revealed he has tested positive despite having had 2 doses of vaccine, but he says he's not experiencing serious symptoms. What has been the message of the government regarding the Delta strain?
It's hard to tell, and there's been a big drive politically towards opening up, and I guess you can see that perspective. What's absolutely clear is things that we knew but have become really clear. So even if you've been vaccinated, you can become ill. Again, it's that question of probabilities. We're not really interested in one individual. We're interested in the whole population of how many people go on to have the severe disease. We do know that the vaccine is much more effective against preventing severe disease than infection in the first place. But of course, that does mean that you can still get infected, so the case rate levels will go up. And of course, the final thing is, there are other hidden additional costs, which are kind of obvious when you think about them, which is, of course, every time anybody's infected, they have to isolate. So then you have, with all the cases, you have this indirect harm caused by people not being able to go to work, not being able to go to school. So there's all sorts of things going on at the moment.
That really is interesting. But Freedom Day has just been declared for England at the moment, not the rest of the UK. How are Scotland and Wales easing restrictions in comparison?
So I think what we're seeing is relatively small differences between the different countries, and to a certain extent that makes sense because there's free movement across the whole of the UK. So there's slightly different emphasis, slightly different changes, but I think in all regions we've had very high rates of growth of the virus anyway, and so ever since we've restricted some of the movement orders a month or so ago, the rate of cases has increased. And once the numbers going up, whether you have slightly different rulings on this, that or the other probably doesn't have as much difference as what we really want to know, which is how much has the vaccination blunted the harm.
Well, when will the UK be able to tell how successful its vaccination program has been?
So one thing that's great, and this is why I remain, and many people remain cautiously optimistic, is that it's already clear that we have a completely different dynamic of infection right now than we did even only a few months ago. So back in January, February, we knew that 2 weeks after the cases went up, the number of deaths went up. Now, we are seeing the same thing with the number of deaths is beginning to increase now, but the link is very different. It could be anything as many as 20 times fewer people being seriously ill. The big question, though, is it 10 times fewer, 20 times fewer, or 50 times fewer? That's what we're waiting for. And of course, it takes at least 2 weeks after the cases go up before you see the impact, maybe 3-4 weeks. So we're still looking at the daily numbers, really closely.
And what restrictions, even if very few, remain in place? Is there a lot of movement in and out of the UK? Is travel still quite free?
It's a really good question. So actually travel is very difficult, and it's not just difficult because of restrictions. I think the biggest difficulty with travel at the moment is that the restrictions are changing on a day-by-day and week-by-week basis. What that means is a lot of people aren't choosing to travel, not because they're not allowed to, but because they simply can't afford the uncertainty of booking flights, planning to go away, and then finding the day before they go that they can't come back without having to go into a quarantine hotel at great expense. So, we're nowhere near freedom of movement at this point.
And that uncertainty of whether or not to travel is being felt right around the world, including here in Australia. Al Edwards, thanks so much for your update. Really appreciate it.
Thank you.